Hello, and welcome to CARE's Cancer Rehab Ed and Support. Today, we're sharing an important update for all primary care physicians across the United States. Let's talk about fertility preservation in people with cancer, and why you, as a primary care provider, play such a vital role in this process. As cancer survival rates continue to improve, reproductive health has become an essential part of survivorship care. The 2025 ASCO Guideline makes it clear: every cancer patient of reproductive age should have a conversation about their risk of infertility, and that conversation needs to happen before treatment begins. You may be the very first doctor a newly diagnosed cancer patient talks to. That puts you in a unique position to guide and support them at a critical moment. So, what can you do? First, assess fertility risk early. Ask about reproductive goals, even if the patient hasn't brought it up themselves. Second, educate and refer. Patients who are interested in having children, or even just uncertain, should be referred to a fertility specialist right away. Third, document the conversation. This shows proactive care and ensures smooth coordination as the patient moves through oncology care. Now, let's review some key clinical points. For men, sperm should ideally be banked before starting chemotherapy or radiation. Post-treatment sperm may carry genetic damage, so early action is important. For women, preserving eggs or embryos is possible, but the timing is critical. Even after treatment, fertility preservation options like oocyte or embryo cryopreservation may still be available, especially for those with reduced ovarian reserve. GnRH agonists are not a replacement for established fertility preservation methods. However, they can be used as an adjunct in breast cancer patients or to suppress menstruation during urgent chemotherapy. And don't forget about cancer survivors. Many didn't receive proper fertility counseling at diagnosis, and their needs or goals may have changed. You may be the one to reopen this important conversation. Of course, fertility care can be costly, but there's progress. As of now, 18 U.S. states and Washington, D.C. mandate fertility preservation coverage for some insurance plans. Federal employees and active-duty military also have access to benefits. Even so, navigating insurance can be complex. That's where you come in, by connecting patients early with financial counselors, social workers, or patient navigators. So, here's the take-home message for every PCP: start the fertility conversation early. Refer patients when there's interest or uncertainty. Support survivors in re-evaluating their fertility post-treatment. And help connect them with the right resources to make informed decisions. Reproductive health is survivorship health. And your early action as a primary care physician can help patients build the future they hope for, even after cancer. Thank you for being part of CARES. For more oncology updates and survivorship insights tailored for clinicians, follow us on YouTube or wherever you get your podcasts. This is CARES. Stay informed, stay compassionate, and help your patients build the future they dream of.